Over spring break, my friend's grandma died. I was at dinner with his parents, his cousins, and his grandpa. This grieving family had been strong and by her side as she battled cancer for the last 3 years. They were sharing their favorite memories of her, discussing funeral plans, and reminiscing through those. She loved doing that memories. Losing a loved one is difficult, but this particular point really stood out. To hear his family say it was her arthritis that killed her, referring to the side effects of her arthritis medication giving her cancer, brought a tear to my eye. Nobody should lose a loved one due to the side effects of a drug, especially one that is advertised on TV, as they said, and inevitably approved by the FDA. Most Americans value being healthy. They trust doctors and regulators have their best interests in mind. Today, taking the flu vaccine and getting medicine for everything that hurts or prevention medication is the social norm, but is it really worth it? An article from Pew Research states that 45% of American adults take prescription drugs on a regular basis, and 27% occasionally take prescription drugs. More Americans now than ever are taking prescription drugs, and by the decisions of the FDA regulators affects a lot of Americans. While more Americans are being positively impacted by the immense amount of medical advances in recent years, the FDA is hurting us by the way they regulate drugs. So it is in the best interest of the American people to pressure the FDA to amend the way they regulate drugs.
Today I will go over what missing data is, how it implicates studies, how the FDA markets drugs as safe without disclosing information to support it, and discuss whether or not the FDA is on the side of public health or not. Let's look at some of the issues of missing data. Oftentimes, there's missing data from studies that the FDA uses, and the term missing data comes from when researchers don't publish their findings because the outcome isn't favorable. The FDA does not use studies done by academics to make a decision when regulating drugs. However, the biggest issue is that the bad evidence against the drug usually isn't published, and regulators never look at it. According to Ben Goldacre in his book entitled Bad Pharma, it says, for all 90 drugs that came into the market between 2001 and 2002, they found that 66% of the trials with significant results were published, compared to the 36% of the rest. The studies with significant results were 2.5 times more likely to get published than those without. Goldacre 25. With only these flattering studies, regulators don't see the ones that have bad outcomes. The regulators get false sense of effectiveness, thus leading to the decisions that should be up for questioning. Missing data is one of the biggest threats to the whole picture understanding of drugs and how they affect people. How can we trust the FDA if they don't make the effort to make sure that we all have the information before approving a drug? While Americans value health, customers need to be more aware of these biases before taking a drug. Let's look at some other issues. The FDA markets drugs as safe without disclosing information to support it. The FDA deprives patients and doctors of valuable information that is used in the regulation process that would allow patients and doctors to make their own informed decisions about a drug the FDA approved. The FDA assumes that they are the only defense that the American public needs to make an informed decision on what drugs are good for them to take. According to Ben Goldacre in his book entitled Bad Pharma, a drug is not either good and therefore on the market and bad and therefore off of it. There is a lot that goes into making a drug effective. It's not just is it bad or good for a person to ingest, or whether it's good or bad for a particular condition. There are different aspects to every person that needs medicine. People have combined conditions or already have tried a drug that didn't work or have more severe kind of condition. This makes every potential drug customer unique. Without the whole picture information, doctors and patients can't make informed decisions for their patients. With all of the information, doctors and patients would discuss the clinical drug studies to the people in those studies and had the same or similar conditions to see how a particular drug affected them and or make a better decision on what drug to take, while regulators would approve it for a condition without caring about how the drug would affect a particular subgroup of potential drug users. They look at information differently than a doctor or patient would. According to a book written by Ben Goldacre entitled Bad Pharma, he articulates that a regulator makes a good decision about whether it's in the best interest of the population as a whole that drugs should be available for use, even if only in some obscure circumstances. Therefore, how can people make decisions for themselves giving all the drugs out there without the FDA allowing the public to see the same things as the regulators? While people trust drug regulators, doctors and patients can only make informed decisions if they have all of the data. Thus, patients and doctors left in the dark about answers to questions they should be able to get the answers to, and leaves a guessing game for doctors trying to prescribe drugs. The FDA is once again failing the American public because they don't do enough to get the data out there to the public. Supporters of the FDA would argue that the FDA has the interests of the American people at the root of everything they do, and regulations in place are completely ethical and legitimate. There are a lot of hoops that potential new drugs have to jump through, like get studies, submit evidence for review before it can be introduced into the market. According to an article by the Food and Drug Administration on how drugs get onto the market, it said it is reasonably of the company seeking to market a drug to test it and submit evidence that it is safe and effective. While supporters are right that evidence has to be submitted and that the process has to be supportive of a claim made about the drug, there are flawed logics assuming that this is enough. This overlooks the fact that the drug companies give the FDA biased research. If a company spends a lot of time and money creating a new drug and paid for a study to be conducted, isn't it within the realm of possibility that all they want is for there to be a drug to appear safe and effective, even if it isn't? Drug companies that are found their own research have a large opportunity for this research to be biased because they have a huge interest in positive results. This is considered having a confirmation bias, looking for ways to justify a prejudiced thought. Drug companies want results that flatter their drug so that the FDA will approve it, and people will take it. In the end, drug companies want their drugs to sell so they can get their retribution back. According to a book by Ben Goldacre entitled Bad Pharma, he articulates that it is entirely normal for researchers and academics conducting industry-funded studies to sign contracts subjecting them to gagging clauses, which forbids them from publishing, discussing, or analyzing data from the trial they have conducted without the permission of the funder. Researchers aren't allowed to talk about their studies. A large portion of studies are done behind closed doors. The secrecy of the perfect opportunity for illegitimate things to take place. If industry-funded trials were completely legitimate, then why wouldn't they worry if scientists were talking about their results? While the FDA isn't responsible for biased trials, the FDA has no policy or screening to make sure that they aren't considering these biased trials when they're approving a drug. Therefore, the FDA is making decisions that aren't in the American public's best interest. Without any policy to prevent these biased studies from being considered, they aren't looking out for the public as best they can. Today I went over what missing data is and how it implicates studies, how the FDA markets drugs as safe without disclosing information to support it, and discussed whether or not the FDA is on the side of the American public health or not. This is why we should think for ourselves and not trust everything that people say as true as fact. So there is in the best interest of the American people to pressure the FDA to amend the way we regulate drugs. In general, Americans trust science, but sometimes you have to take a step back and think about if what's going on even makes sense.